But let me start with the worst news first. And now it's Spain that's becoming the new coronavirus ground zero. It's setting up emergency wards and convention centres as the death toll there reaches nearly 500 people a day. It's so bad now that Spain's defence minister says the army is finding old people have been abandoned and lie dead in their beds. The mayor of Madrid says there's so little protective clothing that undertakers can't take away the corpses. Germany on Sunday tried to stop the spread of the virus by banning meetings of more than 2 people, except for families. And overnight, Britain did the same, as its death toll jumped to 335. Here's Prime Minister Boris Johnson.
From this evening, I must give the British people a very simple instruction. You must stay at home. Because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all.
Now that may yet come here. And let's not forget Asia, where the health systems are far less likely to cope. Just to our north is Indonesia, where as far as we can tell, with obviously their records, 48 people have now died. So this is deadly serious, and we have to buy time for our own hospitals to gear up for the Russian equipment needed to keep the sick alive. And the way we do that is to wash our hands often, keep our distance from people, and don't leave home if you don't have to. As some of the heroes on the front lines around the country, like these medics at the Royal Melbourne Unit Hospital, put it today, we stayed at work for you, so you stay at home for us. But I said I would bring you 3 signs of hope today, and not false hope, but hope nevertheless. First, Australia's figures. Yes, we have had a big rise in cases over the past 24 hours. 25% up in one day to 1,900 infected people now. And that rate is very bad. It's essentially out of control. And there was one more death today, a passenger in her 70s from the Ruby Princess that docked in Sydney last week. What a fiasco that was. Even so, it means our death toll is still extraordinarily low so far. It could change very fast. There are people in intensive care. But just 8 people so far, all very old. That means the mortality rate to this point is much, much lower than many feared. It's just 0.4% of all people infected. Or to put it this way, on these early figures at least, they could change, of every 250 people who get this virus, just 1 will die, most likely someone very old and already sick. And the death rate is probably even less than that, since there's increasing evidence that many people who catch the virus get such mild symptoms that they don't even know they're sick, so they don't get added to these figures. The second hope is Italy, believe it or not. That has been by far the worst hit country. On Saturday, a shocking 793 people died in a single day. But the next day, it was still high, but much lower, 651. Yesterday, lower again, 620. Again, very early days. Could change. But has this virus reached its peak in Italy, as it already has in China, South Korea and Japan? Let's keep watching. And the third and last bit of hope, a cure, possibly. Yesterday I told you about research into a drug called chloroquine. It is an anti-malarial drug that's already been approved for human use. So it's safe, so it's already in production, all tick-tick. There's now research being done on this drug here at the University of Queensland, as well as in France and China, Japan, South Korea and the United States, on whether it can also treat the coronavirus. Now, I said yesterday that other experts were very sceptical about this, There's been no proper trials, and all that is true. Yet, in France, Professor Didier Raoult, a prominent expert in viruses and bacteria, says he has tested chloroquine on humans, tested its safer version, hydroxychloroquine, on its own and in combination with another drug, azithromycin, and claims that the combination drug cleared up the virus in sick people within 5 days. That's the bottom line. Now, US President Donald Trump got very excited by this and said, what have we got to lose? Let's try it. And in Florida, by the way, a businessman called Rio Giardinieri, he heard that. He looked like dying from the coronavirus, had already said goodbye to his family, but persuaded his doctor to give him just one last chance with this chloroquine.
And I said, look, I don't know if I'm going to make it till the morning, because at that point I just really thought I was coming to the end because I couldn't breathe anymore. And he agreed and authorized the use of it. And 30 minutes later, the nurse gave it to me. And when I woke up about exactly 4:45 in the morning, I woke up like nothing ever happened. To me, there was no doubt in my mind that I wouldn't make it till morning. So to me, the drug saved my life.
Now, that's an anecdote. That's not necessarily evidence. But Donald Trump has now ordered millions of doses of this drug, and the Democrat governor of New York, Andrew Cuomo, will start distributing a lot of it in a mass trial tonight, in our time.
The federal government is working to help obtain large quantities of chloroquine.
We're going to get this supply, and the trial will start this Tuesday. The president is optimistic about this, about these drugs, and we are all optimistic that it could work. Some health officials point to Africa, which has a very low infection rate. And there's a theory that because they're taking this anti-malarial drug in Africa, it may actually be one of the reasons why the infection rate is low in Africa. We don't know, but let's find out, and let's find out quickly.
So will this work? Who knows? Who knows? But we'll soon see. But in Australia, the Morrison government is also jumping on board chloroquine and another drug as well.
We have joined with the Queensland government in supporting that. In addition, there have been philanthropic contributions. They are doing a wide expansion of the clinical trial, and there's both an HIV drug and a hexachloroquine, which is being considered as part of it. Then there are new proposals which have come to us today, which have been brought forward by the Walter and Eliza Hall Institute, one of the great medical research institutes, not just in Australia but in the world, a storied home of Nobel laureates. And that institute is looking at the potential for prophylaxis or preventive deployment. And we are considering that immediately, and I am hopeful that within the next 48 hours that they will have provided a strong case, but I am very predisposed to accept that.
Okay. We look for hope to the University of Queensland researchers and to the Walter and Eliza Hall Institute. There's no need yet to panic.